I'm Cathy Weaver, Executive Director of Guideposts of Strength.
I'm Dr. Bernie Chinnasami, and I'm the President and Medical Director of Guideposts of Strength.
Welcome to GPS News, a regular look at the cancer-making headlines that you see every day. Today, I want to talk about something that's pretty obvious. It's October, and instead of us turning the colors of autumn leaves, we've turned pink. Everything is pink. I've had breast cancer, and I don't think I ever had this many pink clothes, pink notebooks, pink ribbons, pink cups in my life. There are those right now who have said we're actually doing too much, that it's become too much of a business, all of this pink. But I wonder, can we make people too aware of a disease?
Well, breast cancer is actually a great example of people taking preventive care to the next step. I think the advocacy groups have really been extremely good about trying to get women to get the mammograms, to self-check, and to basically be able to have the conversations with their daughters, their friends, and everybody else. Screening or talking about cancer is no longer taboo because of them. So I don't think we should underestimate the good that is done. I think that, now when we see pink, the first thing everybody thinks about is breast cancer. I mean, even the finest marketing companies in the world could not have done that. But this is something that's very near and dear to a lot of people's hearts. And I think this just gets to show that if we are able to focus on these things, that we can make meaningful change. What I'd like to suggest is for the people who always feel, gosh, there's so much attention to one aspect of cancer, is that the word cancer should remind us that all of us need to get screened no matter what. And my recommendation is usually, even though October's Breast Cancer Awareness Month, is that the word cancer should then key us into remembering to screen for all cancers. And so women should still be screened for cervical cancer, get their pap smears, get their colonoscopy. So I think pink represented breast cancer to start with, but I think now it's broadly representing more women's cancers.
Well, since we are in the middle of Breast Cancer Awareness Month, I want to ask you a couple of questions about breast cancer. I know the answer, but I'm going to ask it for the audience anyway. Is breast cancer the most prevalent cancer among women?
It is, but surprisingly, it does not result in the most deaths. Lung cancer really does. So as women also took up a lot more smoking, and almost, unfortunately, lung cancer is a lot more deadly than breast cancer is. We made great strides in the treatment of breast cancer, especially since we're able to screen for it. Unlike lung cancer, there's no great screening test. Also, now we know that there are genetic possibilities that raises your risk for breast cancer. We don't have anything like that with lung cancer. So even though breast cancer occupies a lot of time with women and also is the number one diagnosis in women with cancer, lung cancer still takes more lives.
Okay. As the second generation breast cancer patient in my family, my mother had it and now I've had it, I look back at the changes that have happened between my mother's generation and mine, and for hers, they did not want to talk about it. She did not want to go to a support group. This was 30 years ago. She had the surgery, she was done, end of discussion. The nurturing, the support that we see today was really not something that was readily grasped then. In fact, people were not regularly having mammograms at that point. So one generation, in my opinion, has changed quite a bit. However, being in focus groups with other breast cancer patients, I have seen women, particularly from the African American community, who have been surprised that you can survive breast cancer. So I don't think it's overdone. Perhaps it's over commercialized, but as far as the awareness raising, I'm not sure we can do too much.
Till we find every breast cancer at stage 1, I don't think we can ever say that it's overdone. Because ultimately, this is the perfect screening disease. You find it early, you live. You find it late, you don't.
Right.
So to me, there's no such thing as overdoing something when it means the difference between life and death. So I think sometimes that we may have to focus more on some subgroups, like African American women, maybe. And I think that's kind of what, as we evolve into this more, that we'll be able to subset out more high-risk people for us to be able to then be able to do that. And so, like I said, till we can find every breast cancer in stage 1 or less, I don't think we can do too much.
There's one more issue that's in the news right now that relates to this, actually, is ABC's Good Morning America anchor, Robin Roberts, has recently undergone a bone marrow transplant. She developed NDS, a blood and bone marrow disease, as a result of her treatment for breast cancer several years ago. I want to talk a little bit with you about what this is, and also about the complaint that has come up in the media. Are they giving too much coverage to Robin's treatment? And I'll give you my opinions after I get yours.
Well, I mean, unfortunately, some of the ramifications of treating people for breast cancer involves treating them with chemotherapy. And unfortunately, chemotherapy is not benign. And some women pay a high price. And unfortunately, she's one of them who had this bone marrow disorder, probably as a result from her chemotherapy. And unfortunately now requires further and further treatment. So this is one of those things that's a never-ending story. And I think, all of us like to think we're out of the woods once we got our treatment and like to keep things behind us. But unfortunately, it's possible that these things have a long tail. And I think we'll get smarter in the way we are able to use the drugs, how we use the drugs, when we use the drugs. And the world is moving towards less is more. And I think that's true for chemotherapy too. And I think as we do that, I think we'll have better options in how to do that. Also now, women are living a longer time. Sure. And the longer you live, you're starting to see some of these side effects that I may never have seen, because women are now basically living a lot longer. In terms of Ms. Roberts, it's a little unfair to say that she's getting too much coverage, because one, she's in the spotlight. Two, she actually is the next generation breast cancer patient. What do I mean by that? I mean, she survived breast cancer, and that's really not what they're talking about. They're talking about living with breast cancer, for which she's a great example of, but more importantly now, the complications of breast cancer, the dignity she's facing it with. I think anybody who goes through such a horrific diagnosis like breast cancer, then survives it, and then unfortunately has another situation that compounds that issue, is problematic. It's mentally exhausting just to do it the first time. Mm-hmm. To do something else the second time, I think it's even worse. And I think she's been such a great role model, so I don't think we should take that very lightly.
Well, I agree, and I think also she has raised a lot of awareness about the need for bone marrow donors, people to register to be a bone marrow donor, particularly in the African American community. Again, we're coming back to the issue we dealt with just a few seconds ago, but it's an area where a lot of growth still needs to be made.
I think we're making great strides in breast cancer, but everything is a high price to pay for certain people, and she's one of them that have these complications. But I think the dignity and the courage she's showing to face this, not being a quitter. I mean, she's basically a perfect model for people who have complications of therapy, and she's facing it very bravely, and I think she's a great role model.
Well, we here at GPS sent her a big Get Well banner, and we certainly wish her well. If you'd like to know more about breast cancer, please visit our website at www.cancergps.org and go to our cancer section and click on Cancer Guides. And we have a video that will explain the diagnosis, the staging, the treatment, and also give you questions that you can talk with your doctor about. It's a really important video to watch if you have breast cancer or if you have anyone in your family with the disease. Thanks for joining us for GPS
Thank you.
News.
Have a great day.